Managing Care in Module 6. The objectives for managed care are describing and identifying how care coordination is applied in the context of nursing and healthcare practice, discussing the application of healthcare economics in nursing practice, and summarizing the delegation process and key behavior when delegating. Maybe you're asking, what is managed care? Managed care is a healthcare delivery system that focuses on decreasing costs and improving outcomes for groups of patients. In managed care, care is carefully planned from the initial contact with the patient through the conclusion of a patient-specific health problem. Methods to manage care differ by the delivery model that's used, but the goals remain the same. Managed care shapes many aspects of the healthcare systems. As payers search for better ways to contain rising costs, they develop new incentives and standards, which results in new trends in healthcare. Positive trends increase the focus on preventive care, which helps decrease healthcare costs. Trends with possible negative consequences are increases in hospital readmissions after early release, which results in increasing healthcare costs. Each organization uses a particular model of managed care. Nurses must understand these models to care for patients and mature as nurses. In managed care and care delivery models, healthcare providers and agencies work together to provide care that uses limited clinical resources wisely and effectively. Managed care and care delivery models promote health and deliver preventive services, resulting in decreased costs and increased patient satisfaction. To function in one of these models, nurses must have strong communication, assessment, planning, and implementation skills. Nurses must understand patient rights and advance directives. The nurse must be committed to quality improvement. Some people question the application of the business approach to healthcare. Okay, let's talk about case management. I know you've heard me mention this term before. Let's talk specifically about what it is and its role in healthcare. Case management is the coordination of patient care over time using a combination of health and social services which are needed to meet the patient's needs. Case management is the fundamental element of many managed care systems. It's the most effective, efficient model for patients with multiple or chronic health problems. Case management involves interprofessional teams that collectively assume responsibility for planning and assessing needs of groups of patients. Case management is also responsible for coordinating, implementing, and evaluating patient care from pre-admission through discharge or transfer and recuperation. Each team is led by a case manager who might be a nurse, a social worker, or other appropriate professional. They're sometimes referred to as discharge planners. So case managers and discharge planners, you'll often hear those terms used interchangeably. They may work for a clinic, a hospital, or a long-term care facility, or for an insurance company, or for a patient's employer. Patient-focused care. Patient-focused care is a delivery model that organizes healthcare around the expressed physical and emotional needs of the patient. It incorporates concepts of patient and family-centered care, in which patients and family members are integral components of the decision-making process. The nurse takes time to learn about the patient's lifestyle, habits, and family. The nurse is sensitive to diverse religious and cultural preferences, and these preferences may affect the patient's diet, activity, and health practices, which also may affect the adherence to the health care regimen. The nurse works with the patient to develop a plan of care addressing health and personal needs. As part of this plan, the nurse helps the patient acquire knowledge and skills needed to manage the health condition and make informed choices. Patient-focused care model is based on the idea that care should be personalized and coordinated, working towards the patient living as an independent person with a fulfilling life. Differentiated practice. Differentiated practice is a system in which each nurse's educational preparation and skill sets are evaluated to determine how the nurse will be best utilized. This model consists of specific job descriptions, for example, an LVN or an LPN, ADN, BSN, RN, MSN-RN, or APN. The healthcare organization utilizing differentiated practice must first identify nursing competencies required by patients it serves. It must also delineate the roles of licensed nursing personnel and unlicensed assistive personnel. which enables nurses to assume and delegate roles and responsibilities as appropriate. The differentiated practice maximizes time and skill of the individual staff members, resulting in high-quality care at affordable costs. Shared governance is a model used together with the other care delivery models. You'll see this used in units. You'll see it used in organizations, organization-wide, and it's when members of the nursing staff participate with administrative personnel in making, implementing, and evaluating patient care policies. Shared governance encourages nurses' participation in decision-making at all levels of the organization. The participation can be either at the individual's request and be voluntary or be part of the job role. Nurses typically participate by serving as members of the decision-making group. Group decisions may address employment conditions, cost effectiveness, long-range planning, productivity, and wages and benefits. In shared governance, the underlying principle is based on the fact that employees are more committed to organizations' goals if they participate in planning and decision-making. The case method care delivery system is also called total care. This is a patient-centered method in which one nurse is assigned to the comprehensive care of a group of patients during 8 to 12-hour shift. For each patient, the nurse assesses the needs, makes nursing plans, formulates nursing diagnosis, implements all care activities, and evaluates the effectiveness. The patient has consistent contact of one nurse during the shift, but different nurses on other shifts. The case method was known as the precursor of primary nursing. And this method continues to be used in emergency, acute, and in the intensive care setting. The functional method focuses on jobs that are to be completed as part of the patient care. This is a task-oriented approach in which staff with less educational preparation perform less complex aspects of care. This method is based on production and efficiency, giving authority and responsibility to the person assigning the work. This requires clearly defined job descriptions, procedures, policies, and lines of communication. The advantages to this method is that it is economical and efficient, and it also allows centralized direction and control of one or a small number of individuals. Disadvantages of this method is that it has a fragmentation of care, so different tasks will be assigned to a number of individuals. It's non-quantifiable, and as a result, patient emotional needs may be overlooked. Okay, let's talk about team nursing. Team nursing is a delivery of individualized nursing care to a group of patients led by a professional nurse. The team consists of registered nurses, which are trained and licensed to deliver direct patient care. These individuals retain responsibility and authority for patient care and then delegate the appropriate tasks. LPNs, licensed practical nurses, provide direct patient care under the supervision of an RN, a physician, or other licensed practitioner, so a physician's assistant or a nurse practitioner. And then there are unlicensed assistive personnel, UAPs, who are healthcare staff who assume delegated aspects of basic patient care. So this is the group of individuals where care is delegated to. Proponents of this approach believe it increases registered nurse efficiency. And opponents of this approach believe that many patients require more attention from the RN. In the primary nursing care model, one nurse is responsible for overseeing the total care of a number of patients 24 hours a day, 7 days a week, even if the nurse does not deliver all of the care personally. This uses the nurse's technical knowledge and management skills. The primary nurse is responsible for assessing and prioritizing each patient's needs, identifying the appropriate nursing diagnosis, developing the plan of care with the patient, and evaluating the effectiveness of the care. This model includes that some other individuals, either unlicensed personnel or ancillary personnel, provide some care coordinated by the primary nurse. Primary nurse encompasses all aspects of the professional role, so it includes direct patient care as well as management and leadership, patient advocate, everything under the scope of practice really is encompassed in primary nursing, and those tasks and skills are covered by the primary nurse. Primary nurse is the first line manager of the patient's care, including all accountabilities and responsibilities of that role. Here we're going to talk about delegation, and the reason I've placed delegation at this point in the presentation is because there's the potential for delegation to occur across any of the different types of nursing models or any of the types of healthcare system models. So let's talk about what delegation is. Delegation is the process of transferring the performance of a task to another member of the healthcare team while retaining accountability for the outcome. So in the delegation situation, there's going to be licensed personnel, and those individuals are nurses who have completed a course of study in nursing and successfully passed either a practical nurse or registered nurse exam. And there could be unlicensed personnel who are individuals who have had training to function in an assistive role to licensed nurses providing care. There will be times when you are the registered nurse delegating care to a LPN, a licensed practical nurse, and there could be times when you are delegating care to an assistive personnel. On this slide, we're going to look at the delegation factors. Prior to delegating care, nurses should consider the following. Predictability of the outcome. Will the completion of the task have a predictable outcome? Meaning, for example, is the assistance of a client from the bed to the bathroom and back, that has a predictable outcome, right? So we're going to assist the client to the bathroom, do what we need to do in there, whether it's toileting or cleaning up or whatever the situation is, and then whoever's completing the task is going to assist the client back to the bed. So that's a predictable outcome, right? That's a task that would be appropriate for delegation. Is this a routine treatment? That's another question to ask. Is this something routine or out of the ordinary? And is this treatment new for the client? Something that's new for a client is probably not the best task to delegate, only because there could be some apprehensiveness about it. It really depends on what it is. A task that has an unpredictable outcome, like this could go a couple of different ways, is not going to be the best task to delegate to another individual. Nurses need to ask, is there a potential for harm? Does this procedure have a potential to cause harm if done improperly? Is the client unstable? Clients who are unstable, their care should not be delegated to another individual in most cases. The complexity of the task. Does the delegatee, the person who's going to receive instructions for delegation, have the necessary skills to complete the task? Is there a need for problem solving and innovation while completing the task? Is judgment necessary when performing the skill? So if judgment will be necessary when performing a skill, we need to ensure that the person who we've delegated the skill to has the ability to make the appropriate judgment if necessary while performing the skill. And this is going to require that you know the individuals that you're working with. If you're new to a unit, that's not going to be your situation. If you have floated to another unit and you're not accustomed to working with this staff, or you don't know them well, you've never worked there before, you are not going to know if the person that you're delegating to has the judgment necessary to perform this skill. So those are skills and individuals who you would not be using delegation with. Does this skill require nursing assessment or data collection skills? Nursing assessment cannot be delegated to another individual. So if that's the case, this is not the appropriate skill to delegate. And then data collection skills. It depends on what that data collection is, correct? Is this an admission assessment or a data collection on the admission of a patient to a unit? That is not the appropriate delegation. However, if the data collection is, for example, vital signs, that would be an appropriate skill, right, to delegate to an individual, given the client is not unstable, right? Okay. What is the level of interaction that's going to be required with a client during the performance of this skill? Does the client need psychosocial support or education during the task? So if that's the case, nurses have to be providing the education, right? So if the client requires education or requires a lot of support and talking to and coaching during performance of the task or skill, that's probably not the appropriate skill to delegate. Okay, so using the principles that we just talked about, let's look at delegation guidelines. Let's use the 5 rights of delegation the same way that we use the 5 rights of medication administration, right? Or the 6 rights. So the first right, the right task. Okay, are we delegating a task to an individual that has been trained and is competent to perform that task or skill? Okay, the right circumstances. So we just talked about a couple circumstances in which it would not be the right circumstance. So the client is unstable. This is the first time the client has undergone this particular procedure. The right person. We need to delegate this task to the right person. Maybe the individual you're trying to delegate something to has not been trained to do that. Maybe they're brand new. So that would not be the right person to delegate that particular skill to. The right direction and the right communication. So this is incumbent upon the nurse to provide the right direction and communication regarding the task or the skill to the individual that you're delegating to. This is your responsibility. So if you have a question after you've delegated a skill or a task about the individual's understanding, you could just have a conversation, a communication about, okay, so let's go over this again, or let's, maybe could you tell me about how long it would take you to get to this skill, or something of that nature. So we're just going to provide clarification and communication, correct? And then also the right supervision and evaluation. There will be skills that provide that where their supervision needs to be provided. Now, that doesn't mean that you need to be maybe standing over their shoulder, watching an individual perform a skill. But there could be situations where they should not be the only individual in the room for patient safety or something of that nature. So if you have a question about any of these 5 rights, but particularly supervision, then ask the resource nurse or whoever your direct supervisor is. And then evaluation. So you have to provide the right evaluation after the completion of the skill or the task. So this is pretty self-explanatory. It's the nurse's responsibility always to evaluate whatever intervention was applied to a patient, right? Whether it's something as simple as assisting the client to the bathroom and back to the bed, or whether it was something more complicated, for example, completing a dressing change or inserting an indwelling Foley catheter. So the evaluation is incumbent upon the nurse to make sure that it's completed, that the skill is completed, completed appropriately, the device or whatever was going on in that particular task or skill is completed and it's working the way it should. The Foley is draining, or the dressing is, has date and initials on it, or something of that nature. So don't just leave it to that individual. Whoever completes the task or the skill is responsible for their documentation, but ultimately the nurse is responsible for their documentation. Let's do a couple of test your knowledge. A novice nurse is looking for employment and hopes to find a facility where the nursing staff participates in making, implementing, and evaluating client care policies. Which organizational model implements these practices? Is it A, client-focused care, B, differentiated practice, C, managed care, or D, shared governance? The correct answer is D. Shared governance is an organizational model in which nursing staff are cooperative with administrative personnel in making, implementing, and evaluating client care policies. Differentiated practice is a system in which the best possible use of nursing personnel is based on their educational preparation and resultant skill sets. This model consists of specific job descriptions for nurses according to their education or training. Client-focused care is a delivery model that brings all services and care providers to the client. Managed care focuses on cost containment, consumer satisfaction, health promotion, and preventive services. Second, test your knowledge. A nurse is completing discharge teaching for a client who is hospitalized for total hip replacement. The client asks the nurse why there is a case manager involved and expresses confusion about who is in charge. The client states, "I thought my doctor manages my care." Which is the best response by the nurse? Is it A, "No, I manage your care"? B, "You are correct, the doctor is responsible for managing your care"? C, "A case manager coordinates everyone involved in your care to ensure your needs are met"? Or D, "The case manager delegates your care to the nurse"? The correct answer is C. The case manager is responsible for ensuring that all the client's healthcare needs are met in a cost-effective manner. The nurse may be a case manager, however, a staff nurse is not the most likely individual in the hospital setting to be the case manager. An agency usually has several case managers who collaborate with nursing, the physician, and any other departments involved in the care of the client. A physician does not participate in care by being a case manager. Case managers coordinate disciplines of care for the client and do not delegate any care to other professionals.